World Cancer Day holds on the first week of February every year to raise awareness, improve education, and inspire action worldwide, with the goal of creating a world where cancer deaths are prevented and cancer care is equal for all. Well, joining us now to speak on all we need to do to lower our risk is Dr. NESOCHI IGBOKWE. Good morning to you. Good to see you again. Welcome.
Good morning. A pleasure to be with you this morning.
Thank you so much. If we were to begin our conversation about debunking cancer myths, what is the most important thing you believe our viewers need to know?
So in regards to cancer, there are a lot of commonly held myths that really need to be debunked at this point, especially on the African continent. Some things that I hear is that, somehow cancer is kind of linked to a mystical source, or perhaps cancer is caused by sins that one is being punished for, or sins of the ancestors or parents. One needs to actually remove that kind of thought process cause of cancer. Okay. When we talk about other myths that people describe about cancer, one thing that one should actually remove themselves from their thought process is the "it's not my portion" myth, which I hear quite frequently. Sometimes people are pervious to these kinds of diseases. If they say it enough times, that it actually comes to fruition that, it's not my portion. But guess what? Anyone can be susceptible to cancer throughout the duration of their life. Other myths that we need to really be aware of is somehow contagious. A lot of the times people believe that, if they are around or surround themselves with people who may have cancer, that they may actually get the disease as well. But that is not the way that one gets cancer. The only way that one could potentially get cancer is to obtain an organ transplant from an individual who had cancer and donated that organ to them. But even then, that risk is quite low. Okay. Another myth that you need to be aware of that some people believe is that cancer is always fatal. It's always deadly. True, because when you do catch these cancers early enough, then you do have good outcomes, and not all of these cancers will lead to death. A lot of these cancers, when you catch them in their early stages, have quite good outcomes.
And that is quite good to hear, definitely. When we come to talking about cancer, and definitely in the spirit of dispelling myths, like Dr. OKEKE has said, I hope she's still with us. But in the meantime, oh, fantastic. You talked about people removing spiritual connotations to cancer, not being afraid of it being contagious or anything like that. And then also not being afraid of the signs itself, because as you said, it's not always fatal. There are huge chances of survival when you catch things early. So for women, for example, if you had the information to check your breasts as often as you can, and you do find something out of the ordinary, I'd imagine that your advice would be to go ahead straight to a doctor and allow people to know that. So if we're talking about breast cancer, I know that this is World Cancer Day and we're talking about all of them, but specifically with cancer, can you give us information on how women can check their breasts out and find out what is normal and what is not normal?
Can you repeat the question? I think we were going in and out. What was the question,
no
please?
problem. I wanted to ask you if you could give our viewers some insight into how to examine their breasts and how they can identify when their breast is normal, feels normal, and when it is not, and perhaps they should be seeking medical attention.
Okay, so in regards to breast checks, that's a good point that you did bring up. One should actually do routine home breast examinations, just basically in circular motions from the various quadrants of the breast. You're really anything abnormal or unusual. You're also checking for potential discharge from the breast. You're also checking for something called skin changes that we call peau d'orange. One can potentially see the change of the skin of the breast, looking like the skin of an orange. Signs and symptoms are specific for breast cancer. But in the spirit of World Cancer Day, I think what's key to know are some of the generalized symptoms that really should alarm one to actually go and get checked out by. So now, one of the first signs that really should be a red flag is any time that anyone has any kind of unexpected, unintentional weight loss, meaning that you've lost a whole lot of weight without even trying. That is a red flag that you definitely need to get checked out ASAP. If you're somebody who's having excess fatigue, excess tiring for no reason chronically, you need to get checked out. That might be a potential sign. If you're somebody that's experiencing persistent fever, persistent potential sign as well of a potential cancer like a leukemia. Other signs that one needs to be aware of are what we call lymphadenopathy, lumps or bumps in various areas of the body. If you find an abnormal lump in another region of the body, that should. Okay. Other generalized signs and symptoms that you really need to be aware of include changes to the skin. Perhaps if you have a mole that you notice is kind of changing. We call this the ABCs of the skin. If you notice to that, there's irregular borders of this mole. You notice a change in just the kind of morphology, the way that it looks. That's a sign that you should get that mole checked out for a potential cancer. Other generalized signs and symptoms that you really need to be aware of, if in your bowel or bladder habits, meaning that perhaps you have a bowel movement and you notice blood in the stool. That's a sign that you need to go get checked out. If you notice that you have blood in the urine, that's a sign that you need to get checked out as well.
All right. Well, NESOCHI.
Hello?
All right. Well, okay, I can come in now. Sorry, I caught you. When you were talking about, God forbid, we just interviewed a lady the other day, and she kept on saying, she said her husband died of cancer, and she kept on saying, when they told me, I said, God forbid, God forbid. And that's where people must understand that faith does not deny reality, but it defies reality. Well, where are we at? Cancer detection and cancer prevention, where are we at that? And what are the challenges faced by cancer patients and physicians like you?
I didn't get that last question. I think you were asking something about challenges in regards to what, please?
Faced by cancer patients and physicians who have to deal with these patients like you are.
Okay. So a lot we actually face actually are in regards to getting patients to really get some of those checks that they need to do to kind of catch cancer before you actually do the appropriate, before you actually have symptoms. What we call the challenge is having a patient go in at the appropriate time, that age in their life whereby they need to check for certain cancers. So when we're talking about cancer, such as colon cancer, for instance, some of the screening that needs to be done for colon cancer is what we call endoscopy. This is a procedure for Black patients that we should start having that done at the age of 45 years. So a challenge is really making sure one does have that screening modality performed at the proper and appropriate time. In regards to breast cancer, get their routine mammograms, which is just an X-ray of the breast. So that really should start happening at the age of 40, the mammograms for women. Okay. Other screening that really should be done at what we call the pap smear, basically screening and checking for changes in the cervical cells of a woman's body. That really should be done starting around the age of 21. Other screening that should be done as well, prostate checks, usually starting between 45 to 50, mental examinations, and also a test called prostate-specific antigen, a PSA, to check if there are elevations in these numbers that might potentially mean that they have issues with cancer. So I think a huge challenge is making sure and ensuring that patients actually do at the appropriate time.
When cancer is detected, what next?
Okay, so when cancer is detected, you need to really meet with a team of doctors, including an oncologist, a cancer specialist, to come up with a plan. The stage of the cancer, they can determine whether or not this cancer actually requires potentially radiation, potentially chemotherapy, potentially excision of the cancer. But really the next step when the cancer is actually diagnosed is meeting with your care team, who will actually let you know what these next steps are to beat and try to treat your cancer. Am I still there with you?
Yeah, you're still here with me. All right.
Fantastic. I wanted us to talk a bit more, of course, about cancer. We know it's a disease, sadly and scarily, that does not discriminate. And often, if it's left undetected, it does not come in vain. That being said, is there a way that we can identify the causes of different types of cancer? Is there something that people can do in terms of their lifestyle choices, their dietary choices, that can limit their exposure to developing cancer itself? Or is this something that strikes at random?
Absolutely. Great question. So when we're talking about cancer, I think first it's key to really understand what cancer is and why this kind of happens. So cancer, it's caused by these changes, these mutations to one's healthy DNA. So when you have this mutation or change to the healthy cells, when it's cancerous, what can happen is that there is this rapid proliferation, this abnormal growth of these mutated cells. When you have this abnormal growth in various regions of the body, that is what we call a cancer, when this abnormal proliferation, this abnormal rapid cell growth of unhealthy mutated cells occurs in the breast. It's a breast cancer. When that unhealthy rapid proliferation of cells occurs in the prostate, then you have a prostate cancer, okay? So what you really need to understand that there are factors that contribute to some of these mutations leading to cancer. There are these factors that you need to know about that you can control, and then there are these risk factors that you can't control. Okay, so first, the factors that you cannot control, we have no control over this, is aging. As we all age, you increase your chance for some of these mutations in the healthy cells to occur over time and potentially have a cancer. No one can control the aging process, and as we all get older, we increase our risk. Another factor that you cannot change is your family history. Okay, if you have a family member, a first-degree family member, mom, dad, siblings with certain kinds of cancers, that also increases your risk for cancer. You have no control of your family history. Now, you talked about the lifestyle choices. Of course, there are lifestyle choices that one can make that can lower their risk for some of these cancers in general. Okay? One lifestyle choice, if there's one lifestyle choice that viewers need to change at this point in their life today, if you are a smoker...
I'm so sorry to have to interrupt you there. We do need to take a very short break, but when we come back, we will continue this very important discussion with Dr. OKEKE IGBOKWE. Please do stay with us. Welcome back to the morning show here on Arise News. Now, earlier this week, it was, in fact, World Cancer Day. And as people continue the awareness of the disease throughout this week, we are joined by Dr. NESOCHI OKEKE IGBOKWE. Thank you for staying with us. I know that you were interrupted there before we went on break. And while I'll give you the floor to finish your point, I wanted to also ask you about perhaps gendered issues affecting people and how they treat cancer. So, for example, I know earlier you talked about breast cancer in women and in rare occasions in men too. And there's also the instance of prostate cancer in men, and men of a certain age should be focusing especially on areas of their body, but it does seem as though for quite some time men have traditionally shied away from looking for signs of illness, most especially when it comes to a disease like cancer. What can you say? That is another thing that needs to be dispelled in the interest and for the sake of the lives of men around the world. What type of advice would you give men who are seemingly reluctant to put their own healthcare first and go searching for signs that they could be sick?
Yeah, so traditionally we do know men of all cultures, they do shy away from healthcare and from getting their checkups until things are kind of way past the point of fixing the problem. At later stages, they tend to try to seek out help. Here is what needs to really be done. A focus really needs to be on prevention for all people, for all genders. Men should really take care of their healthcare needs and really adhere to a lot of the screening metrics and the age-specific recommendations for checkups. Don't wait until you're actually having the symptoms. Like I stated earlier, in regards to prevention, the key is really the screening, adhering to these screening modalities. The point of all of this is trying to even detect the cancer before you actually start exhibiting symptoms. So if you are a male individual or even female individual, talk to your doctor to really understand and know the various age range in which you should start getting a lot of these screenings done. So in regards to the colon cancer, start at age 45. In regards to issues with prostate cancer, you want to start between the ages of 45 to 50 to discuss the screening for prostate cancer. But really the key is having the preventive measures in place and following through with just your regular annual checkups so that you can determine when it is time to get some of these screening tests done. And also knowing your risk factors and trying to minimize that risk.
All right, let's look at the issue of, she brought this up, and that's quite interesting now that she brought it up, the issue of prostate cancer. I heard from somebody, so I want to confirm, that prostate cancer is actually in men, that something and at some age begins to push it to the surface. Is that correct?
Okay, so the prostate is a walnut-shaped gland that actually produces kind of seminal fluid. And over time, when there are certain cells that begin to abnormally proliferate, they become kind of mutated and rapidly grow out of control. And that process happens in the prostate. Then one can actually now have a prostate cancer. When we're thinking of any of these cancers in general, what you need to understand is that this is an abnormal cell growth in the various organ. And when it gets out of control and the abnormal mutated cell really proliferates in that region, then there is actually a problem. Okay, so with men that have any of these prostate symptoms, the symptoms can manifest quite differently. Various symptoms can arise.
Are you there?
I'm still here with you. I can hear you now.
All right.
Thank you.
Okay. Yeah. Yep. All right. Let's see.
Sure. In the meantime, again, I think that it will go a long way to have these conversations and educate ourselves and our viewers to the signs of this disease and the fact that there is really nothing to be ashamed of. It's so easy to not want to believe reality when it comes to the signs of this disease, but as you rightfully put it.
Like when she would say, someone would say, God forbid, God forbid.
Exactly.
Yes, God forbid, but then there are realities and you have to factor these realities in. All right, well, the theme, let's just briefly talk about the theme for this year's Cancer Awareness Day. I am and I will. What inspired this theme? What does it really connote?
So what does this all mean? I am and I will. what this means is that we all need to be aware of cancer risk for all of us. We all need to be aware and know the steps that we can take to lower our risk and make sure that everyone has this global awareness about how cancer actually occurs and how we can actually take the steps to prevent it. So I think I alluded to some of the risk factors that you can control and that you cannot control. I didn't get to really mention the ones that you can control, which are key for lots of patients to really know about. The factors that you can actually control that will lower cancer risk, the first one is smoking. If you are a smoker, you need to quit immediately. If you're thinking about starting to smoke, don't do that. Why? Smoking tobacco or tobacco use, it has what we call carcinogens, okay? The chemicals that encompass tobacco or cigarette smoke, it has at least 70 known chemicals that are known carcinogens that can cause cancer, not only in the lungs, but in various areas of the body. Cigarette smoking has been linked to other cancers, including bladder cancer, cervical cancer, colon cancer, kidney cancer, liver cancer, stomach cancer. So it's not just lung cancer that one needs to be aware of when we're talking about smoking history and tobacco use.
Let me see if I can chip in. Well, very important questions, but let me see if I can chip two of them in, and let's see how briefly you can handle that. One is the treatment of cancer. How expensive is it? And for those who cannot afford the treatment, how can they get help? That's one. Then secondly, what are the major differences between cancer treatment here in Africa, in Nigeria, and the developed countries?
Okay, so great question. So cancer treatment is extremely expensive and can cost upwards of thousands and thousands of dollars. The longer that you do require the treatment for chemotherapy and radiation, potential surgery, obviously the more expensive it is going to be. Now, here's the major issue that I've seen that occurs in Nigeria or in various African nations. A lot of the times when patients are faced with these cancers and they require this kind of treatment, resources seem to be quite limited on the African continent. There is an issue to access to the appropriate care to even treat effectively and efficiently a lot of these cancers. And a lot of these cancers are unfortunately found in the later stages when it is harder to treat. I have personally had patients who travel from Nigeria to come to the US to try to obtain the necessary treatment. Okay, so it's an unfortunate state of affairs.
Dr. OKEKE, I'm so sorry to have to interrupt you there, but that we have come to the end of our allotted time for this conversation, but we want to thank you for your time and for your expert advice. Thank you very much.